but we're a little bit past time, so we'll call the meeting to order. First thing that we've done almost all meetings is have everyone introduce themselves, make sure that we know who, and then who's on the phone. So let's start, Arvind, we'll start with you, go around the circle, and then we'll ask who's on the phone.
Arvind Singh, Chip Coordinator, Lake Health County, Lake Health District, Lake County.
Okay, Health Superintendent, Lake County Schools for number 7.
Jack Thompson, Superintendent of Lake County ESD.
Jill Harlan, Lake County Public Health, a nurse.
Jimmy Hall, Lake County Examiner.
I'm Charlie Twait, I'm the CEO here.
Sheree Morgan, Lakeview Gardens, Social Services.
Christy Albertson, grant writer for Lake Health District.
And who do we have on the phone?
Maybe Bethany Management.
Paul McGinnis, Greater Oregon Behavioral Health and the Eastern Oregon Coordinated Care Organization.
Excellent. Well, welcome everyone. Jack, I haven't met you yet, but welcome.
Thank you.
You just started at ESD, or?
Yeah, July 1.
July 1, well, that's no longer just anymore.
No,
So,
my
good.
feet are wet. Yeah.
Excellent, excellent. So, pleasure to meet you.
Thank you.
Nice to see you, Jill. Thank you for being here. First order of business is that we would approve the minutes. I believe we've sent this out to you. Jack, did you get the emails?
Yes, I did. Yeah.
Has everybody had a chance to look at the minutes? And if you have, I would entertain a motion to approve them.
I entertain the motion to approve.
Seconded and seconded. It's been moved and seconded. All in favor, please signify by saying aye.
Aye.
Any opposed? Same sign. Excellent. Thank you. Next, Paul, you're on the phone and you're up to talk about the Lake County Incentive Mission progress.
Yes, thank you, Charlie. I'm sorry that I couldn't be there in person. I had other meetings today that I had to attend. In the materials that were sent out, people should have gotten the progress report for 2017, the first one that we've seen this year on how we're doing on the incentive measures. Arvinder, is that being projected?
Yes, I have handed out the document to all of them.
Okay, thank you. So hopefully you can hear me, but on the front page shows all of the counties, and then there's a single report for Lake County.
Paul, I just handed out the Lake County report to them. Did you want me to hand out the first page also?
No, that's fine. We'll just go to Lake, but the formatting is a little bit different this time around. The people at Moda Health were able to meet our requests to turn these percentages more into tangible numbers for the CAC fan. So if we're looking at the Lake County report for July 2017, this includes all claims that have been processed through April of 2017, and then any other claims through the end of July. So there could still be claims coming in that will add fees. For 2017, the first column is the target. That's what we're supposed to be trying to achieve. So for adolescent well care visits, we have 37.3%. Right now, Lake County as a whole has a 10% achievement rate. In the numerator and denominator role, that there are 221 people that are eligible for the adolescent well care visits. So far, we've done 22. So the numerator is how many we've done. The denominator is how many are eligible. And over on the right-hand side, we need to do 60 more adolescent well care visits to meet the 2017 target rate of 37.3. You can see that there are two greens that basically are being met, but the emergency department utilization will continue to rise. And if we have 184 more emergency department visits, during the rest of the year, which is very likely we will not meet that measure. And as you can see, for hospitalizations after mental illness, there is no numerator or denominator because no one's had that yet. So I think that the way that this data is displayed may give you a better sense of, especially that member count to meet the need, helps you get a better handle on what needs to be done. If you could relay any questions to me, Arvinder, through the group, because I couldn't hear some of them too well, I'd be glad to answer questions about where we're at.
I'll do that, Paul.
Paul, this is Charlie. I have a question for you. I got the data with the patient-specific information. And as I looked at some of the people that, and our clinics are looking at who has to have what kind of service, I looked at, as an example, under the childhood immunizations, there was a list of those people that, for whatever reason, haven't gotten their immunizations. If I give that list to Jill, so it may well be that they've already provided the immunizations. Is that correct? Paul?
Yeah, I'm thinking of who you're talking about, Jill.
Jill,
Just public health.
Oh, okay. That measure, Charlie, you know, it's what, as soon as they turn 2 years old, you go back to see whether they've gotten the full panel of required immunizations.
okay. So,
Does that make sense?
so then the list that was sent to, that was sent to me by the CCO, that listed, I'm assuming, for example, in the adolescent well care visits, the 221 is the denominator. They listed all 221, well, no, the 199 people that had not had their adolescent well care visits.
Right, that's only for the people that are assigned to that particular clinic, Charlie, which
Okay.
is yours. This data up top, you know, that 221 would also include kids in North Lake.
Okay. Well, at least if we have that, so if I give you that list, I didn't want to email it because it's got private information. So at the end of the meeting, I'll go to my office and print it out for you
Perfect.
and give that to you, because I just got this report, I believe it was in the last couple of days.
Yeah.
So that would be helpful. Is that correct, Paul?
Yes, and that's true that you shouldn't be sharing that list with community members.
Oh, I'm not.
That's private information.
That's why I don't send it out. That's very private information.
So, Arvinder, if there aren't any additional questions there, I just wanted to point out to Mindy, since she's on the phone, she may not have gotten materials. We need 19 more sealants, Mindy, to meet the measure in Lake.
So we will not be providing services at the schools until April.
Okay, so hopefully maybe they'll be getting it at the clinic.
Hope so, yes, the clinic does look on course, but in the outreach, unfortunately, we won't be any help there. But yes, the clinic ideally.
So if we don't provide that at the school, we will not be able to meet that measure for this year. Is that correct?
Not as services in the school, correct?
Same here, Mindy, if we have the teen health fair, like we spoke about in mid-October, and a representative from Advantage and he can show up, we could probably get the dental sealant, the remaining numbers during the health fair. You think that would be a possibility?
If possible, again, I need dates as soon as you get them confirmed, and then I need to submit a proposal and get approval to either have myself or other staff there, but that is a possibility if we can get it organized and make sure we can provide staff.
Yeah, we are planning on the week of October 16.
Okay, Is that a set in stone? Last we spoke, you didn't have a date, so can I submit that date or?
Again, it's, for now I know we are gonna be conducting it during the week of October 16th. I don't know the exact date, which day it will be in the week. We'll probably.
Or if you wanna let me know if
Yeah,
you know, then I can.
Yeah, I'll do that. Probably we'll decide on the date.
You're talking about, Arvind?
So we are planning to do this teen health fair, where we have a lot of health partners who will have their own stations. And
And where and when?
so we are planning to do it in mid-October. Again, we are discussing it, and we are planning to do it in the ADA gym.
Okay.
And yeah,
And Susan's in the,
I have spoken to her. I need to get that solid confirmation.
okay. Okay.
Do you see it?
It's the first I've ever heard of it, so anyway.
Okay.
So we did the screenings. The screenings went fine, right? We did the screenings about a week or two ago.
Yeah, we did it last week.
Okay.
It was okay. The reason was because this time the registrations were online.
Mhm.
Many parents didn't show up at the school. I and Mindy were there. We were handing out the consent forms. So last
So we
week.
provided screening,
Yes.
we provided the screenings on, I'm sorry, the 11th, I believe it was, and there was 30-ish screenings. Ideally, we had sent consent back to the school to be distributed that were labeled with all the kiddos' names that we had not received the consent from, and those, the school didn't realize they had received those, so they did not get distributed to the kids before we showed up. So we're hoping to be able to provide another day of screenings in conjunction with the conferences, maybe like the day before, go ahead and offer the screenings to the kids in the schools, and then be able to provide the services during conferences. So unfortunately, we still had really low numbers, again, 30.
So you talked
we were able
about,
to screen last
you said no,
week at the elementary.
okay. You said no sealants until April. Could you do the sealants in November during the conferences when the parents are there?
We're not able to attend the conferences in November due to scheduling conflicts, so we're working with the conferences in April.
Oh, okay, all right.
And Mindy, we also did some numbers in April this year, right? Was that again 30?
What was that, Arvinder?
We did some dental screenings in April of this year. Do you remember?
We provided services in April at the conferences, and those numbers that I don't have in front of me, those had been submitted before. I apologize, I don't have them right in front of me.
Yeah.
But they were extremely low. That was offering all services, screening, fluoride, and sealant. We had a great number of consents returned, but we had a low show rate at the conferences to actually get access to the children.
Yeah, I was just reminding, yeah, I think we had around between 20 to 30 in April, and then we did 30 last week, and hopefully we can capture some more in the health fair.
Okay. If they do the screenings, what about the sealants?
So sealants weren't allowed last week. I think Advantage Dental could only do the dental screenings. Correct me if I'm wrong, Mindy. We just did dental screenings, not sealants last week, right?
Correct. We were only allowed to offer the screenings during the school hours. The other services we're being allowed to provide at conferences. So again, last week's services were only screenings, no other services.
Yeah, thanks, Mindy.
Thank you.
Paul, is there any more we should think about in terms of these numbers, other than we've got a lot of work to do?
No, but I mean, I think it seems more manageable when you see the numbers of what it takes to meet the measure. But I did have some additional information for the group. I didn't hear everybody's introduction. Is Christy there?
Yep, I'm here.
Albertson?
Hi, Paul.
Okay, hey Christy. So here's what's going on. The Lake Community Advisory Council has $33,598.74 available to you guys to do planning for next year's incentive activities. That's non-competitive. We're hoping that the board will, the board of the EOCCO will approve all of this at its November meeting. Applications would be due by the end of January, and March would be the funding time again. So that money's set aside for the late CAC. You'll hear more about this as we go through, but they're looking at doing some additional opt-in grants, which you guys have taken advantage of. I think you have the colon cancer and adolescent well, correct, Christy?
Correct.
Okay, so they're going to do some opt-ins on some of the ones that we've had some trouble meeting over the years. The first one is the emergency department requirement. In 2018, one of the measures will be what's called our first disparity measure, so people with health disparities and how they're doing. So this will be a count on people with severe and persistent mental illness, so already having that diagnosis, and their emergency department utilization. One in particular that they're hoping that public health departments may want to apply and opt in is on childhood immunizations. They're also looking at doing an opt-in on the developmental screenings, as well as another round of adolescent well care. Projects around tobacco and in specific cigarette use. And then something that fits well with your plan, your community health improvement plan, efforts to control diabetes and hypertension, both of which will deal probably with physical exercise and better nutrition.
Is that targeted at the whole CCO population or a specific component of that?
It would be, you'd be targeting those folks that are OHP members, Charlotte. The adolescent well clinic activities will still be all kids. I mean, like when Mindy goes into the schools, or we do something in the schools, we're doing it for everybody. Those are two places where we're not discriminating about whether they're OHP or not. But the other opt-in should be targeting people who are uncontrolled diabetics and hypertensives.
And this is for money that we could prepare some kind of request to provide to the CCO board in the spring. Is that correct? Or January, right?
The opt-ins would be due at the end of January as well.
And we think we'll know about this, whether the board approves it in November?
Yeah, I'm hoping that we meet in November. I just saw a notice go out that they were looking for December dates, but I told our internal group that the board would need to vote on this by email if they're going to delay until December, because our groups are there'll be too much opportunity for there to be holes in budgets that ended last year, if you understand what I'm saying.
I do.
If there's a delay in getting money to people.
Okay.
There's also dollars set aside for continuation of projects that have been approved in prior grant applications. I don't believe Lake has had one of those.
Did you have a question?
And then you're going to see a document that's for new project ideas and pilot projects. It will be for up to $50,000. And in this case, Christine Group, you're eligible to apply for that at any time. aware of that. And so my main point right now is start planning now what you're going to do with that $33,598.74. And if you want, I'll bring a quarter and a penny and we'll round it up to $599. But, you know, I think you want to start your planning now. So that when the application is going to look the same as it did last year, Christy, if you want to use those questions and what you need to do. So
Okay.
I'm urging you to start because it's already October.
Right.
Any other questions?
I had a question. This is Jack Thompson, Lake County ESD. On the dental sealants and things and the screenings, have you reached out to the Plush, Adel, Paisley, and North Lake? Have they done those?
I'll have to ask Lee to answer that question.
Yes, and we have school scheduled, and actually, and I apologize, I was thinking strictly Lakeview, so obviously it's updated on Lakeview. However, North Lake, we are providing services there this next Monday and Tuesday, and we will be providing all services, screening, fluoride, and sealant. So that, again, I apologize, I was thinking of Lakeview, not Lake County, but yes, we will have a chance to do sealant there, and could very well move that number there. And as far as Plus and Adel, we will be scheduling them. They aren't currently confirmed dates, but we will be scheduling them as well. And Paisley, we have confirmed dates as well.
Okay, fantastic. Just I wanted to make sure you reached out to the Plush and Adel, so. Okay.
Jack, is there a chance?
I did, and thank you for bringing that to my attention. I completely split my mind because I was fixated on Lakeview. My apologies.
Yeah, you'll probably get just with North Lake alone, you'll probably get those numbers, so.
Any chance?
Okay, fingers crossed.
Yeah.
Any chance the ESD patients could be done separate from the main school?
The ESD patients.
Or students?
Students.
Excuse me.
We don't have any specific students.
Oh, you don't?
No, the ESD does not have any students.
Okay.
Yeah. They register with us, so we could, the homeschool, that's something that you could do through the ESD, is if you could get those screening forms or the permission forms to the ESD. We have the list of the homeschools students, and we could get that and mail those out to the homeschool families, and they may or may not take advantage of the opportunity, but at least that's a way to get to those people.
How many have we got homeschooled in Lake County?
I honestly don't know right now. I'm not sure. I haven't asked that question. I'm not sure. Sorry about that. I should know.
No problem, that's a great suggestion.
Yeah.
Maybe we can, our vendor do that. Yeah.
It's the same kind of thing is, I mean, we're not gonna release that information to you guys, but if you give us the forms, I'll be happy to make sure those get mailed out to those homeschool families. So.
Okay. And if we needed postage to supply the postage?
I don't think there's that many. I'm guessing it'd be under $20. I'm not gonna worry about it.
Jack, if you can meet me after the meeting, I have the consent forms in my office. I can just hand them to you.
Fantastic. Okay.
Excellent. Thank you, Paul. Anything else we should?
Sorry.
Sorry.
Yeah, just one more thing on those new projects, just to get your minds moving. They specifically identified a few areas. One is to develop and implement programs to help communities develop alternatives to emergency department use. The second one is developing programs to increase collaboration with public health departments and primary care practices to achieve specific incentive targets. Establish a fund to assist key clinics with specific incentive targets, and based on the change that you saw at the grand board meeting, provider recruitment assistance.
Good.
That's all it says, Charlie. I don't know what that means. I think you're going to have to get creative.
We can do that.
That's what the new ideas are about.
Are you going to be able to send that description that you just came up with out to me, and I can disseminate?
As soon as it's finally approved. But this looks like it's already been through the process channels. It's just not ready yet. I'm just giving you a heads up. When it's ready to distribute, you guys will be on my distribution list.
Okay. Because certainly there are some, just thinking about this, if we could partner with the school, partner with public health in ways, if we're going to work on efforts to control diabetes, which is a lot of education or a lot of exercise, if we could encourage kids through working with the school for some activities that would support the school as well, because that's really where we're not in the position to do a lot with the kids, but the school is.
Well, I think we're already way ahead of you. The state legislature has imposed a law to increase our PE minutes. And at this time, as far as FTE and spaces and actually able to fit it in our schedule, supposed to be implemented this year, 2017. We didn't have the wherewithal to do that, and as well as other schools across the state of Oregon. So they gave us either 2 or 3 more additional years to get something together to add minutes on to PE every single day for K through 12. 150 minutes a week for K through 3.
They just didn't give you any money.
Didn't give us any money. It's the usual mandate.
So,
And then do 225 minutes a week for, I think, 4 through, what is it? Is it 4 through 10 or 4 through 8?
I think it's still 4 through 8, because the high school, I don't think, well, maybe it's.
Of course, no, absolutely, they can give us some.
So what I hope you're hearing is that there is some money through the CCA that we might be able to specifically target for using it as a grant to try and direct it to where it could be used at the school to try and focus on helping reduce diabetes
It'll
through
sure help
exercise.
us if you can use it in the way of FTE.
Well,
FTE is going to be the issue.
Paul, will there be restrictions, do you think, on that money?
I'm sure there will be. I mean, it's limited to 50,000 on the new project ideas. If you're talking about specifically the diabetes and hypertension, Charlie, those are going to be opt-ins, which are basically already described, and you decide whether you want to do it or not.
Okay. So that's the part I need to try and get the specific language, so as we talk with
Understood, but I still, I would still hope that you guys start thinking about those things.
Okay.
Because even on the opt-ins that you have now, you can tweak some of it.
We can. Okay, so maybe what we need to do is look at that and see how we can make some adjustments. Is that what you're suggesting, Paul?
Yeah, think about it, but, again, urging you to decide what to do with the 33,000, whatever. You know that's there, and you know it's got to be part of your community health improvement plan or targeting an incentive measure.
Okay. So for those of you that, as you're listening to this, when we look at ways to get credit, if you will, for example, looking at effective contraceptive use. The way we get credit for that is when and it's for girls, it's not really for boys, to come in and be seen by a health professional and have a discussion about contraception. Is that correct, Paul?
Well, the discussion doesn't end it. You have to have the prescription for a long-acting contraceptive.
Okay. So somehow we need to, if we want to meet the measure, we've got to get girls getting that prescription.
What exactly the long lasting? Are you talking IUD or what are you talking?
The pill,
Oh, okay.
So figuring, because if that's really being done in public health,
It is, but we have some different programs, so I don't know if this data accepts our program numbers. I wonder if.
I think that's one of
figure
our,
that out.
that's one of our big challenges. is
Yeah.
You have clients that you talk to,
Mhm.
and that they may be getting the prescription. Paul, if they get the prescription and the EOCCO pays for it, we get credit for it.
That's when it counts, yep.
But see, if they're on the C-Care plan, which is a government plan,
We don't actually report that to the CCO.
right,
How do we get around that, Paul? If that's provided through another program to the same recipients, we're not getting credit for it.
Well, I think you would document that in the medical record and flag it to MOTA.
okay.
We can talk about,
Well,
so
yeah, we can
what that
talk
would
about
mean
that
is,
in the immunizations.
what we would,
Charlie, that's the same as the women who have had a tubal or a hysterectomy. They're considered on an effective contraceptive, and because that service may have been provided years ago, you have to document it and send it in.
so I've heard that one of the other counties took a Excel spreadsheet, listed all the people that were recipients of, say, whether it was from public health, so they were getting some sort of contraceptive service, or had received, as you said, hysterectomy or tubal ligation. And that was provided to MOTA Health, and that they got credit for. Is that correct?
Yes, they should, yes.
Okay. So Jill, that's something that we could possibly, and that would really help everybody, and it doesn't change how how you're handling the care of those clients. Okay, that's good to know.
So just another point there, Charlie, for the group's benefit. 50% of all births in Oregon, not just Medicaid recipients, are unintended.
Say that again?
All births in Oregon, doesn't matter what your insurer is, 50% of all pregnancies are unintended.
Not planned.
That's why the program that we deal with that to help do it is called the one key question, and that is that they're asked, do you intend to become pregnant during this year? And then the decision tree goes yes or no. If it's yes, then we get them on prenatal vitamins and make sure that we get them in for the other incentive measure, which is early prenatal care, adequate prenatal care. And if they say no, they don't intend, it opens up the discussion about contraception.
And it isn't asking about, it doesn't change the conversation in other ways, because some people don't want these kinds of conversations to occur.
If they don't want it to occur, there's not too much we can do, but the provider should ask the question.
Okay?
And Charlie, our MAs got trained for asking the one key questions in June or July this year.
That's true. One of the things that we're finding is sometimes if it is a physician or a male asking the question, it is difficult to respond to. So if our medical assistants, who are predominantly women, ask that question, it's a little easier. And I imagine you have that same kind of experience in public health.
Yeah, we don't have any men there, so I think it makes them more comfortable. I don't know. We'll see.
We want to provide it in as safe an environment for a response that's appropriate as we can. Okay. Good. Anything else, Paul?
No, thank you. And again, I apologize for not being there in person.
We appreciate your update. Arvinder, would you like to moving on to the CHIP updates?
Yes, thank you, Charlie. Good afternoon, everyone. Starting with the updates, I will give some update about the Gatekeepers program. So we had a productive meeting last week with all the program partners. We are done with the first leg of the program, that is sending out and receiving the surveys. We are planning on training a community member sometime in October. And once a person is trained as a gatekeeper, then we have to let 4 to 5 months pass away, and I'm gonna do a second round of surveys that we'll send out. And based on the second round of surveys that are returned, we'll do a comparison between both the surveys, and yeah, we'll get some findings if the gatekeepers program was effective or not. Going to the next update is the Living Well program. So our clinics, in collaboration with the prevention department, we're working on 2 Living Well programs. That is.
Could you remind everyone what Living Well is?
Yeah. So Living Well is a program that has come out from Stanford University, and so we can adopt the program and use it in our hospitals or county. So for example, we were working on 2 Living Well programs. One is chronic pain management and diabetes program. The idea is that we have some healthcare professionals who will first get trained and they'll become facilitators. And once they're facilitators, they will conduct these workshops in their community. The people who will attend the workshops it can either be out of their own if they want to attend it, or how we are going to go about it is we are going to get referral lists from our providers, and yeah, we're going to contact them and hopefully they show up for the workshop classes. And we have, so there are 4 to 6 week classes, or you just have to attend once in a week. And then there is a follow-up on the people who have attended the classes if the Living Well program has been effective to their particular condition. So that's what we are working on. Our plan was to start with the chronic pain management Living Well class first, and then we wanted to go with the diabetes Living Well class, and the diabetes will also help us with the diabetes incentive measure. We had a setback with the chronic pain management class. One of our facilitators has been on a sick leave for quite some time now, and we need minimum of 2 facilitators to, after they are trained, to conduct the workshop classes for the patients. Chronic pain management classes have been stalled at the moment. We are focusing on the diabetes, and because of the setback we had with the chronic pain management, what we are doing is we're going to train 3 facilitators. One is going to be the prevention coordinator, Francie, and other 2 are going to be MAs from our clinics. They are Becky McLean and Amber Stewart.
So they don't need to be an RN? Nurse,
They have to have some history of diabetes.
Well, this is for diabetes, not for the chronic pain.
Yeah, this is for the diabetes now. So we are sending again the 2 MAs and our prevention coordinator next month for getting trained in Medford.
Through the Living Well program.
For the Living Well diabetes program, and again it's going to be mid of October, October 20th. Once they get trained, I've already worked with our clinics and our providers are aware and they have the referral lists of the patients, and once we get our facilitators back, we are going to try and launch the workshop classes as soon as we can, late October or early November. And yeah, so we'll be conducting the diabetes Living Well workshop classes. Chronic pain management, we'll have to find another facilitator. Do you have any questions regarding that?
It's difficult to find people that want to deal with a problem we have in Lake County as well as elsewhere, and that is certainly chronic pain. How do we deal with that? We can come up with alternatives to dealing with people that have pain. Anyone have thoughts outside of who else we could get to get trained to help deal with this? If you do, please let us know. It's a hard one.
Going to the next update, the colorectal cancer screening. So colorectal cancer screening, as Paul mentioned, was one of the opt-in grants that we got earlier this year. So our colorectal cancer screening project is going live tomorrow. So the introduction letters and information brochures will be sent out to, we're going to be sending out to around 130 patients. Again, to remind you about the colorectal cancer screening, this project is focused only on the EOCCO patients between the ages of 50 to 75. And this will help us to identify people who are at high risk of getting cancer and also improve our preventive numbers. Again, this also helps us with our incentive measure for colorectal cancer screening, and we have targeted around 130 patients in Lake County, and according to the progress report, if 31 or 35 of them reply back to us, we will cross our EOCCO 2017 target. And I can give you more information about how we have set up the colorectal cancer screening program, but I think I do that like every CHIP meeting. So I can brush up if anybody wants. How we have done is, us, which is Christy, some help from the clinics, the quality, we form all the information, intro letters, the information brochures, the script for reminder calls, and we send it to the EOCCO. EOCCO is working with a vendor called PrinceSync, and they are going to be sending it out tomorrow to all the patients. However, we are going to have our logos, so it's going to be from the Lake Health District. So tomorrow the introductory letters and information brochures are going to be sent. After 2 weeks, we are going to send them with the HemoSure kits. And when we send them the kits, we are again going to remind them they can either just mail the HemoSure kits to our clinics or they can come and hand it in person. After a week of that, we are again going to, PrinceSync will be doing reminder calls to all the patients. And yeah, and depending on, and we have also attached a $20 incentive for people to take part, which we are going to use the opt-in grant funds that we have for that. And yeah, and depending on if we receive any kits, our labs will do the testing, and depending if it's positive or negative, we will take the next steps.
So people getting a $20 incentive to have a lab test done, even though it's not exactly something that people like to talk about or think about, it still is important to have done, and it saves people's lives. Hopefully we'll have a good outcome.
Yeah.
Okay.
Going back to the next update, developmental screenings. This was one of the incentive measure grants we got again at the start of the year, which is non-competitive. So we had originally, again to remind you, we had planned a diaper program for developmental screenings. Our thing was to give out a $10 worth diaper packet to the parents for each visit of their child's developmental screenings. So the way we had set up this program, we were going to collaborate with Lapine. And Lapine is going to start their diaper program, diaper and gas card program again in October. And we wanted to coincide with that date. I've been speaking to Lapine, and we have funds allocated. However, because we have received all the funds, we are going to place the bulk order for the diapers and hand it out to our health partners. So for now, I'm just waiting back to hear from Lapine of how much quantity they need for the diapers. And so again, the timeline for this, what I've planned is that I feel we can start, our clinics can start handing out diaper packets to parents who come for developmental screening sometime in mid-October or late October.
And that might be something we could talk about with the media, to talk about how important this is. Because we want, how many times do we hear of moms deliver and they don't go back to see their doctor for 2 years? And they don't think they need to bring their child in for developmental screening, no matter how many times public health calls or somebody else calls. But it's important for them to do. You try to reach everybody, or all the moms, right?
Mhm.
And you have pretty good success?
Yeah, at the very beginning, like that first month or so, because they just had a new baby. Then if their baby's fine, then it's harder to get a hold of them.
Do you think the diaper packs will be an incentive?
Hope so. So if they came to public health and we did their ASQ there,
Yeah.
but we send them to the hospital, but our key person is gone now, so I need to get another key person.
Yeah, and I'll be getting back to you on that. So
Okay.
again,
We could give them all the packets of, diaper packets to
Yeah.
give there?
But we also have toys to give too that we were given from another grant.
okay.
So, but I could talk to you about that and you could tell me how to work with you on that.
Just get a bigger bag.
And we only
I'm
give
thinking you got
credit.
diapers, you got toys, I'm coming down.
I know, we'll do an ASQ.
Hopefully you don't need the, just the toys.
This is the toys.
And we only give the credit if the ASQ is reviewed by a provider.
Yeah.
Which is why
Within
the
30 days.
incentives
So-
are
Oh.
analytic.
So that's why
Mhm.
when we do it, we fax it in
Mhm.
and then they're supposed to try to get them in that 30 days.
Mhm.
Yeah, and to add to what Krishi was saying, so we conducted some rapid improvement events with our clinic staff, and we found out that the process of submitting the claims is what we are lacking at the most, and that's why our numbers are not. And yeah, but going forward, we will. I think the rapid improvement was done in July. That's why I'm waiting for the October or November progress report, as our clinics are saying. Incentive measure numbers should be better in the next report. But yeah, I'll get back to you, Jill, and we can set up the system again to get the ASQ forms and submit it in time.
Do we have any other updates?
Yes. So the teen health fair, as our previous discussions on the health fair, I think it was the last to last CHIP meeting when Beth Hadley had given the idea to conduct them in October because you start your flu shots season and also immunization program. So I have reached out, so again the idea of the teen health fair was we have, in the venue we'll have a couple of stations. The children will be handed out a passport of sorts where each station they visit, it gets captured in the passport, and and the final stop will be the provider, so that it's easier for them to see if they have. And again, the reason for the passport was if they go to all the stations, they get an incentive when they come to the final station. So I reached out to public health, I've reached out to Advantage Dental, Crisis, what is that thing called? I'm forgetting. Our crisis organization?
Wellness Center.
No, yeah, Wellness Center also. We also have Crisis.
Crisis Center.
Yeah, Crisis Center, and even Chamber of Commerce. So, and they for now, the information I have is that we have time set up in the week of October 16th, and I've also spoken with our clinics. So even Water Mountain will be taking part in this teen health fair whenever it is, and our clinics. And we have set aside some time for the providers to be available during whichever week we plan to conduct the teen health fair. And yeah, that's the update, and we can discuss over the teen health fair. So I've already spoken to you. You were fine with the week of October 16th. And Mindy, are you there?
Yes, I'm here.
Yeah. For now, we are deciding on the week of October 16th, as I've already told you. I can speak with other departments. Again, this meeting was rescheduled, so they couldn't make it to the meeting today. And again, speaking to Susan Warner and the principals, I can see which what date we can confirm on, and I'll send out a mail.
Well, we have an administrator meeting on Monday morning at 8:30. Why don't you come down to that?
I can do that, yeah.
Okay. I think are you just saying strictly teens, or what age group are you targeting?
Adolescents.
You keep saying teen health fair.
It's
That's
11 to 18, is that right? I don't remember.
Yeah, it's actually adolescent
Uh-huh.
welfare, I think.
And if we call it adolescent, could be 11 to,
yeah. I'm just thinking logistics and everything else. You know, the majority of your population, ADA, is under 11, under 11 or 12. You know, and I think probably the best place to do this would be the daily middle school gym instead.
Okay.
And, the ADA gym, you've got PE going on in there all day, and it's also the cafeteria during lunchtime. High school gym, of course, is used all day. However, the DMS gym,
Okay.
hardly used at all. So I think that'd be the more, appropriate venue for that.
Yeah,
Great-
that's a
great
good
suggestion.
So anyway.
good suggestion.
And I'm curious too, so are we looking at offering this during school hours? Are we looking at after? I apologize, I've asked some questions and I haven't really I know it's not all been confirmed and all that, but the more information I have is obviously going to be beneficial, but are we looking at school hours, after school? How is it going to be advertised?
We are looking for after school hours.
And targeting adolescents after school hours to offer the multiple services.
Sorry, what did you say? Could you repeat that, Mindy?
So it will be an after school hours, just using the school facility, but after school hours, offering the services, targeting adolescents, and offering the multiple screenings and services. Is that correct?
Yes.
Okay, and do you think that by the end of this week, you will have an exact date nailed down?
I feel Monday would be,
Yeah, let's get together on Monday and talk.
I think by Monday, Mindy, I can give you the exact date.
Perfect. If you can let me know as soon as you know, that would be great.
Yes, I'll do that.
Thank you.
Can I catch a couple of things?
Oh, absolutely.
Regarding incentives, before when we had talked about having this in May, June-ish, the prizes that we were gonna get for the kids if they got their passport stamped was a pool pass, and that's really not an option now. And then I think it was Beth, it might have been you, but I think it was Beth. We talked about if we had this after school, because we do have sports and things going on, that maybe an incentive to get some of those kids who are playing is what an incentive could be for the coaches. We will donate X amount to your team for whatever. I don't know if that's a possibility.
Well, October, basketball season, every gym is impossible during basketball season.
Yeah.
But in fall, there's a little bit of volleyball here and there, but the
Football's still
gyms are
going,
not
but-
all jam-packed like.
But if we can get the coaches to let their kids come through here before practice, is that an option? Like if you let your football guys go through here, we will donate.
I think the
football
best
to the
guy to
team.
talk to, I think that conversation is for Rusty Zizet on Monday morning. He'll be at the meeting. I think he's the best guy to talk to about that.
So maybe both of you could go,
Yeah.
Okay,
if that is possible.
sure.
Good. Because we want to, if we can help get them to get some of the screenings. I mean, it's not like they're sick.
Yeah.
It's this is all preventative, so it's hard to find urgency in preventative care.
If we're just doing it on one day, I know like JV football plays on Mondays, so that might take away
Yeah, we need
a
to stay
few
with
kids
yeah.
from that day.
Volleyball's Tuesdays and Thursdays. And
Yeah, so it's
Fridays
kind
football.
of, it's almost too bad we can't do
Wednesday it
it
is.
Monday and Tuesday, just so that you could hit them on either day.
Mm.
Okay.
Monday to talk about that one.
Anything else that you wanted to update?
That's it.
One of the things that we're doing that I wanted to report on is we've talked about the community health worker or the Navigator training program, and that started last week. So several people within Lake County are attending that. It's kind of an exciting thing for us. That'll allow us to better identify clients that, or I don't necessarily want to call them patients, they might be patients. They're individuals that a lot of times have a harder time getting the coordination of care arranged. We find that if a new mom is has a couple kids, getting to a doctor's appointment, getting to a dentist, plus work, plus school, plus, family issues, all those things often are difficult to work around the health system. So finding ways to help them with that, that's really what a navigator does, or a community health worker. The terms are not quite synonymous, but very similar. And so the OSU Extension School held the training here. So that was a good thing for Lake County. It was typically held in LeGrand or in Pendleton or on the coast where the extension schools are held there. So I think that's a very positive thing. And we did receive some monies from the Eastern Oregon CCO. We talked about this last month, how we would use some of that money toward the operation of this Community Advisory Council, but also to be used toward education. So we're going to be use some of those funds toward that training program. So I think it's another example of how we're using money from the CCO to benefit Lake County and Lake County residents. So hopefully, when they finish their training program, that will really make a difference for us. So, other issues that anyone has that we could be thinking about as it relates to this Community Advisory Council?
I have a number to throw out.
Oh, good.
Since I just finished our final grant report for the summer food program, and our vendor got me all the numbers from all of the different sites. We served 2,373 meals this summer. Carl and your family was proud of it. So thank you. So that was
2,373
meals.
And the goal was like 1,000.
We was at what, 1,500? I think.
Yeah,
so
we exceeded it.
Yeah.
So it was a pretty good success. And I don't know if you will see a difference in how well the students do this fall, but it's clearly documented that if kids have good food and do well, that helps them be better students. So I don't know if a Head Start will want to take the project on next summer, or if they'll ask us to participate. But it did come out pretty well.
Yeah.
So all that helped out, we really appreciate. And great job to the two of you that worked very hard on it, as well as others. But that was a lot of work, wasn't
It really was.
Charlie, I forgot there are some more updates. I'm sorry, Christy, did you have some grant updates?
Yeah.
I forgot to ask you.
The big one, Jake Greer found out, so we being the health district, especially the wellness center, partnered with probation and parole to apply for a couple of grants for drug treatment court back in January, February-ish. And we are still waiting to hear on the federal grants because, the feds do nothing quickly. But we heard back earlier this month from the Oregon Criminal Justice Commission. We got just under $158,000 for our county drug court. So that'll go, it's supposed to go for people because that's what makes it possible. Right now, our max in treatment court is 15 clients. And it's simply because we don't have the drug counselors to handle it. Our probation parole people are already maxed out. So this money is specifically to help us hire some more people so that we can get more people who need treatment court. And treatment court, again, it's your last ditch. If you do not get help for your substance abuse problem, then you are going to prison. So it's a really good program, and Lakeview has worked really hard, Lake County's worked really hard to model it after the national standard, national best practices. So we've gotten some pretty good recognition from the state, and now we're getting money, so that was encouraging.
What is the time period to spend that 150?
It's over the next couple of years. I'm not sure what the start date, I think the start date was July or September, which I realize those are very different months, but it was either starting now through 2019, so,
Excellent.
yeah.
So now if we can just find people that want to be, that are therapists,
Yeah, we need some more bodies.
that's really good news.
Yeah.
Excellent. Do you have other grant information that you can impart?
We just submitted an application to Meyer Memorial Trust, which is one of the bigger grant makers in the state, one of the bigger private foundations. And it was a big deal, because Meyer doesn't make as many grants as they used to in Eastern Oregon. They changed their focus a few years ago, and that's a long story. But this was specifically for housing plus healthcare, and aligning the systems. And for a long time, this community has been talking about the need for transitional housing or supportive housing. We have wellness, the mental health, they do assessments for clients who are in crisis. DHS does assessments, probation parole does assessments, and we all kind of work together on the fly. If Jake has a client who also has mental health issues, then he'll call up Trace or Heidi or someone and say, hey, can you come here and help? But it's not there's not a formal structure in place to do these kind of joint assessments and to come up with plans where we work as a team. And we're seeing the same people in the emergency room, in mental health, at DHS. It's just over and over, we're seeing these same clients. And so we submitted a proposal to Meyer that would give us some seed money to put together a program which would look like purchasing a property, a specific property, where we would have an on-site residential manager to coordinate this program. By coordinate, I mean oversee people living in transitional housing, women in crisis who are being abused, or someone who has been released from the emergency department after a mental health crisis and needs a safe place to go, someone who, that's the issue, we need safe, stable housing for these people while they work to get their lives on track. So the money we're asking for would do the three parts: to buy a property, to renovate the property, to meet the needs, to meet, if the health, it was the health district who applied, so to meet whatever laws and codes we have to meet, and to meet just housing, basic housing needs, and to hire this residential site manager who, in addition to overseeing the clients and providing accountability, would act as the liaison, so that we get someone in and we can immediately get a team together, get DHS there to assess for their social health needs, housing, employment, foster care, whatever other needs they might have that DHS would cover, and probation parole could come in and assess for their legal court-related needs, and mental health could come in, a clinic if we have physical health needs. This is going to provide, we hope, a one-stop shop kind of situation where we can start treating these people that we're just seeing on a regular basis. And so this grant from Meyer is not for very much for a project like this. It's $50,000 a year for 2 years if we're successful. So we're also looking for other big dollar grants that help us really get this off the ground. And the hope is, because we're going to be charging, all these different agencies are charging for their services, and we can be charging the USCCO as far as inmate treatment, and that it eventually would pay for itself. But we really need to see money to get this thing off the ground. So that's where that project is at.
Excellent.
Is there any, with this, have you looked at any properties that might fit your needs best, or locational wise, or?
We've looked at a few, and
size?
there are things, I mean, there are different hotels. The one that needs to just be knocked down on the main drag into town, there's one across from the kiddie park, the whole, whatever that hotel is. There's a boarding house, there are different properties out there, but
Well, occasionally the county does get foreclosure lands that might work, so keep in touch with me here in the
Yeah.
next couple of months, because I'll get the new list for what will become available
okay.
for auction in June, but I
Good.
can pull something from the list if it's something the county commissioners would like to donate. So.
Perfect, thank you.
I believe the state law allows us to donate for purposes like this. So,
Okay.
I've been
but
told
it's
that other
really
counties,
rare.
I've been told that other counties have done that on occasion where, rather than auction it, they've donated it.
It's rare when we get something close to town, you know, but,
Yeah.
and size, everything. Sometimes I at least look at.
We're on the list too. USDA has its different programs to get people into housing, and they do all the background checks, but sometimes those fall through too. So if anything ever pops up on the federal loan level, then, yeah. So there aren't very many there either, so the more resources we have like that, the better.
It's a difficult need. It's something that Lake County certainly has a need for. And other counties have already done things to move on in this area. So if we can find it, that's good. Of course, then we always run into that problem of it's not in my backyard. But hopefully we get around that. Do we have any updates from the senior center or?
Not that Andrea's made me aware of. We still are looking at maybe being able to help Lakeview Gardens with transport back from a hospital stay. So we're still looking at that, and ODOT has sent us some information on what we can use the vans for. And it seems to look like we might be able to do that.
Good.
So.
Good. Well, if, do we have any other issues that people, Jack, this is your first meeting. We have differing sizes of attendance, but usually what we're busy talking about as a community advisory council are, it seems like we're spending most of our time talking about the EOCCO needs and the metrics that we are struggling with meeting, but at the same time, we also talk about health needs of our community. So it isn't just for people within that insurance group, but we also have targets for seniors and others within our community. So
Yeah, I have a project that I'm just trying to get off the ground just now. I'm going to be hiring calling it a threat assessment coordinator. It's going to be a part-time position, and what the position will be is if we have an issue in a school, we have a student making a threat. Right now, we don't have a real clearly defined procedure on what to do with that student, what we need to do to evaluate the threat, to determine whether it's viable, whether it's not, whether it's just boys being boys, or whether, my goodness, we got a real problem here. And so Salem Kaiser School District developed a threat assessment tool a number of years ago, probably 10, 15 years ago. And I'm going to model ours after that. The Willamette ESD in the valley there, they use the same threat assessment. They have this position at their ESD, and I'm going to use that person to do training with our person. And basically what it will do is this person will go out and will train the principals in the different districts on how to do a threat assessment. The threat assessments within the school typically ends up being the principal, a teacher, counselor, and then this threat assessment person can also join in. And if they have any other person that maybe needs to be there, they can. And 90% of the time, I would say 99% of the time, it's boys being boys, it's girls being girls, it's I'm mad at you because you let the air out of my bicycle tire, and I yelled out that I was going to kill you. And so the schools have to take those things seriously, but this way we can evaluate that student and make a determination and saying, okay, they're not a credible threat, they don't have access to weapons, they don't have a list, they're not doing, they don't have any other signs of doing this kinds of stuff. If they do that level 1 threat assessment and they do determine that, you know what, there's some things here that we have got some serious issues, then I'm going to be coming to mental health and looking at getting a called a level 2 threat assessment team that will hopefully include law enforcement, mental health, school psychologist, those types of folks that will then, and of course the parents would be included in that and those kinds of things, that would sit down and do a level 2 assessment of this child and say, does this child need some mental health counseling? Do we need to have them evaluated by a school psychologist or a psychologist? Does this student need to be adjudicated? Is there, does the kid, let's check these things out. Let's go check out his bedroom, kind of thing. Let's ask the parents and things. So it really helps define what needs to take place when that kid yells out, "I'm going to kill you," and what that really means. And because it's scary. Was the last week out of Spokane.
Yeah.
There was a shooting there. A boy was killed and 2 girls were shot. We don't want that to happen, and so we need to have something a little more defined. So anyway, that's a project I'm working on that will possibly involve maybe somebody from the health district. I'm not sure. As we move forward, we'll see what's available.
Trace Wanzer would be the person to talk to at the Wellness Center.
What was the name?
Trace Wanzer. And that would be she'd be a good resource to talk with about how do we incorporate that. So that
Right.
whether it's crisis management or it is a systematic process that somebody has made an allegation or made a statement.
Right.
It may not be in crisis, but it is urgent to be evaluated and assessed.
Yeah. And where did you say her location was?
At the Wellness Center.
Wellness Center, okay.
So are you familiar with where that is?
Nope, but I can find it.
Perfect.
Close to the senior center.
Okay, I know where that's at then. Yes, I do want that. Yeah, that's great, because that's kind of what I'm saying. I'm just in the first stages right now. I've got the job description, and hopefully we'll get that posted here in the next couple of weeks out there to see if we can find somebody. I'm hoping to, my expectation is to hopefully find a retired law enforcement just looking to work just 8 hours a week kind of a position. So it may not be a 8 hours every week. There may be weeks where they don't do anything because there's just nothing going on. Everybody's trained, everything's in place, we're all there, everybody's above board, ready to go. And then there may be a week where, oh my goodness, we have 3 things happening in a week, and they're driving to North Lake, and they're driving to here, and they're so it will be kind of just as needed kind of a position. So
Excellent. Excellent. That would be a very positive thing for us. It's certainly a proactive way of looking at how do we deal with what could be a horrible thing.
right. And hopefully when we can find out these things, that it gives us a chance to really look at kids and hopefully determine that kid, like the kid in Spokane, and say, well, there's more here, we need to delve into this a little bit deeper and hopefully circumvent that from happening.
Right.
Yeah.
Excellent.
One small update I just remembered, and I promise it'll be the last one. So our Food Co member will be here soon. She's in Bend at the moment, undergoing a Food Co related training, and she should either be here on Sunday or Tuesday.
So she will be
She'll continue the stuff Rochelle Hansen had started.
okay, working at the school at ADA and working on
Union.
Or excuse me. Beg your pardon.
Mm-hmm.
Yeah, and she'll also have teaching classes and also tending to the greenhouse. We have set up a greenhouse at Union, and yeah.
And that seemed to be a pretty good program, I think.
Project's been going well, yeah.
Good, good. All right. Well, does anybody have anything else that we want to talk about?
I know it's way early, but for the summer food program, I know you mentioned it before that we would try to work with Head Start to see if we could get them to help run it. My just opinion, having gone there much this summer, is that we're still missing a lot of the target families that we need to. I mean, yeah, there was a few families like mine that was there pretty often, and it was, beneficial to some, but if we get it back in the Head Start, to have them help it, and then, I mean, the help that we had was tremendous, but it needs to be kind of centered around low income more.
Yeah.
And, or we're just wasting our time, I think. I mean, because a lot of the families that were there didn't have to be there. We didn't, it was just, we're there because it's, you know, to try to get people more, you know, to show up.
Was there something we could do to target those in terms of maybe,
So if we know way ahead of time that we're gonna have the funds and do it again, then I would say, you know, putting out flyers at the schools and, you know, and especially at the Head Start and other places. And even, you know, more posters or something just down even lower income areas that we know of, just to let people know.
Was
The
it a
unfortunate thing is if parents aren't home and their kids might be, then, you know, getting from, you know, maybe south part of town into to the park is difficult.
Where were the lunches served this year?
The kiddie park.
Kitty Park.
Kitty Park.
And at Union School for a month, and down at the state park in Pine Creek, and then
Okay.
we served a couple of Vacation Bible schools as well.
Okay, good, so you got different areas. I was just thinking, a perfect example would be to serve at the Head Start building.
Yeah.
Because that is on the
Exactly,
south end of
yeah.
town.
Yeah,
Exactly.
if possible to go
And
there,
that would be,
absolutely.
and that would be great with them helping. They have that new building and it has a fantastic state-of-the-art kitchen in it. So which, if you make a peanut butter and jelly sandwich, you don't need state-of-the-art, but it is clean and it
That's
is,
absolutely right.
stainless steel and that.
And it's just gonna sit all summer.
And that's a good location to where kids could walk.
the reason we did take it on was because the building wasn't complete.
Yeah, it wasn't ready.
And so we did because we wanted to make sure that there are kids getting taken care of.
We
And
hadn't
you-
had it for 3 years.
Pardon me?
We hadn't had it for 3 years, because Head Start was in the middle of that capital campaign, and they couldn't do it, so.
Right.
And it's possible that maybe transportation was a bigger issue in that if we are invited to participate again, that we might think about how we could coordinate a way of picking up kids with a bus or something to that effect. Do the school buses get used a lot in the summer?
Not at all.
Would it, if that,
Then the Head Start has a bus too, so,
what?
I mean, there's a coordination factor there with them also, so.
There could be, yeah. I think we were limited with what we could do with the funds that we got.
No, they didn't match funds at all.
Yeah, and I vaguely remember hearing that Head Start wasn't gonna have their bus this year.
Yeah,
I'm not
that's
sure.
what I heard too.
Yes, I'm not sure if that's
But
true, or if
they're not doing busing.
gonna get it back or what, but.
It was something about the funding and not having a driver hired at the correct time or something.
We could figure out maybe something with the school buses or whatever. Conversation with my transportation supervisor and Tony Shannon.
We were learning a lot when we took on this. We had some assistance from Vicki, but a lot of it was, as Christine and Arvinder were working on it, learning about it. And we tried to pick locations thinking it might accommodate people more. But I don't know if we did enough on the west side.
And I'm not saying we didn't do it right, it's just that and it was the same 3-4 years ago as
Yeah.
well. And I went to them then, and it was the same group of people who were still showing up every day or a couple times each week, and you're still missing the right population. So if it is held at New Head Start building, that will, I think, should make a big difference.
You have ideas about the north end too, because Charlie and I had talked about that. There's just nowhere on the north end of town that we can think of. The cemetery, but that's down.
Yeah, it is sad our park situation in town. So.
But at the same time, if we have transportation, we're accommodating a need.
Yeah.
And after all, that's what we're doing this for, is to help those people that really need the help the most. So, well, thank you very much, everyone, for coming. And we'll be letting you know as much as we can about the funding as it becomes available. Thank you, Mindy, and thank you, Paul.
You're welcome.
You're welcome, thank you.